The other types of movement disorders is dyskinesia. It's an abnormal, uncontrollable, involuntary movements. There are many different types of dyskinesia with symptoms that range from minor, just like tics, very simple, to full body movements. It's associated with brain injury. Commonly نشوفها after antipsychotic medications or on long-term use of L-dopa, مثل ما قلنا levodopa, in the treatment of Parkinson's disease. And the commonest of types of dyskinesia, tardive dyskinesia, which is commonly seen in patients with Parkinson's disease using long-term levodopa. In our clinical practice, we used to see cases with oculogyric crisis or torticollis, especially in young, male or female, commonly in female, using antiemetic drugs, for example, metoclopramide, blasil, or prochlorperazine مثل الستيميتيل. فشايفين بعد ما نعطيهم هاي الميديكيشنز يصير عندهم يعني اما oculogyric crisis او torticollis with that dyskinetic movement type of dystonia. The second or the other important muscular or movement disorder is myoclonus, which is a brief and rapid, irregular, isolated, random jerk. It's a rapid, irregular, random jerk. كلها نصير عندنا of muscle groups. This is a physiological at the onset of sleep. كلها نصير عندنا متري تنام بعدك ما غافي رأسها نصير عندك فد نزل. Hypnic jerk نسميها hypnic jerk. This is a myoclonus or myoclonic jerk. لكن اللي يهمنا هو المايوكلونس اللي يصير in patients with cerebral cortex disease like those with epilepsy ونسميها myoclonic convulsion or myoclonic epilepsy. The other movement disorder is epilepsy or fit or convulsion, commonly called myoclonus.
These perioral movements.
نرجع هسه للdyskinesia. This is example of tardive dyskinesia in patients with Parkinson's disease using medications.
This movement disorder also involves the neck muscles, which should be scored on section 7 of the examination.
عادة نحن نشوفها in
For now,
movement of the
focus
mouth.
on just the perioral movements. Notice the frequency, also the amplitude, that is to say, the size of the movements.
نسميها lip or mouth smacking.
These perioral movements.
This is example of patients with myoclonus epilepsy. شوفوا sudden jerky movement, involuntary. This is epileptic patients. He developed myoclonus. Fit is abolished now. Other abnormal muscle or movement disorder is tics. Tics are stereotyped repetitive movement, either very common, such as blinking, head shaking or shoulder shrugging. Unlike dyskinesia, patient may be able to suppress them. إذن هو مثل الvoluntary movement لكن متعود يسوي الحركة يكررها يصير عند كل الناس. Although only for a short time, isolated tics are simple, which become repeated unnecessarily, common in childhood and usually disappear. يعني أطفال عندهم مرات عادات يحركون يعني حلقهم أو يحرك خشمه أو حركات بيده أو بشتفه. This is tics, which is repeated unnecessarily. The other important movement was myokymia, which is a persistent, twitchy, rhythmical movement, may affect periorbital muscles as involuntary. من عندنا facial nerve involvement or irritation involving the eyelid muscles contraction, typically involve the lower eyelid, also called hemifacial spasm. فإذا إذا صارت بال unilateral part of the face سميها hemifacial spasm. It's a type of myokymia. Cramp, أيضا very common يصير عندنا كل احنا it's a spasm of part or muscle, especially calf muscle, occur in normal people or in heat stroke, cramp. مرات تقعد من النوم فد severe spasm, especially in the calf muscle. It may be idiopathic or due to heat stroke, in hyponatremia or even hypomagnesemia. Tetany أيضا abnormal movement occur due to hypocalcemia or alkalosis when the patient have carpopedal spasm. طبعا هنا عندنا two tests, Troset test and Chivostic test to test for tetany and hypocalcemia.
Hemifacial myokymia is another disorder of the seventh nerve, but in this case probably due to brainstem
myokymia.
This is a patient with multiple sclerosis, and what you can see are continuous undulating fasciculation-like contractions in the distribution of the seventh nerve. Now this disorder is different than the benign orbicularis myokymia, which I think all of us have experienced during times of stress, that little twitching movement that you can feel under the eye. The difference in this disorder is that the movements spread to other areas of the seventh nerve,
so could
not
affect
just around the eye.
Around the eye and even
now watch as we move downward. You can see these movements in other areas
around the mouth
that are subserved by the seventh nerve.
Muscles supplied by seventh cranial nerve.
You need to think about intrinsic lesions of the brainstem, multiple sclerosis, tumor, for example. Look at these fasciculation-like
This fascicular movement, this myokymia.
Continuous rippling undulations of the muscles subserved by the seventh nerve. Here we're shining light obliquely on the skin and it creates shadows. This is very similar to the technique that's very useful to bring out and show fasciculations in, for example, amyotrophic lateral sclerosis. Using room light that's... So close your eyes.
The patient with hemifacial spasm, unilateral movement, contraction of the muscles supplied by the facial nerve, orbicularis oris. They have حصل examination of the facial nerve. Blepharospasm, another movement disorders. Blepharospasm, contraction around the eye, repetitive.
Now look to your right. Look to your left. Look up.
With normal ocular movement.
Look down.
All the muscles are
Look straight
perfect
ahead.
to walk.
Close your eyes really tightly now. Open them up wide.
Thank you.